Before explaining all that stuff about the femoral triangle, see the hip bone and the femur bone, the medial side and the lateral side. On the femur bone, this is ilium and this is pubis. On the ilium, we have anterior superior iliac spine, or ASIS. On the pubis, this is pubic tubercle. The femoral triangle is a wedge-shaped area located within the superomedial aspect of the anterior thigh, and is a channel for the structures entering and leaving the anterior thigh. The femoral triangle has three borders: superior, medial, and lateral, a floor, and a roof. The superior border of the femoral triangle, or its base, is formed by the inguinal ligament. It runs from the anterior superior iliac spine to the pubic tubercle. The medial border of the femoral triangle is formed by the medial border of the adductor longus muscle. The lateral border of the femoral triangle is formed by the sartorius muscle. The most common and easy mnemonic for borders of the femoral triangle is SAIL. It stands for sartorius, adductor longus, and inguinal ligament. The muscular floor of the femoral triangle is formed by the iliopsoas laterally and the pectineas medially. The roof of the femoral triangle is formed by the fascia and skin. Apex of the femoral triangle is where the medial and lateral borders cross each other. More important than the borders of the femoral triangle is the contents of the femoral triangle. We will discuss the contents of the femoral triangle from lateral to medial side one by one. The most lateral structure is the femoral nerve. Toward its bottom, it divides into three branches: the cutaneous branch, which supplies the skin, the muscular branch, which supplies the muscles, and the saphenous nerve, which follows down the femoral artery and travels down to meet the great saphenous vein. The next structure is the femoral artery and several of its branches. Then, femoral vein and its branches. The most medial structure is the femoral canal and the lymphatic vessels. The femoral canal is an empty space containing lymph nodes and fat. It is a very dangerous site for hernias, which we will cover in another video. To memorize the contents of the femoral triangle from lateral to medial, remember the mnemonic NAVAL. It stands for nerve, artery, vein, empty space, and lymph nodes. To understand the femoral triangle, it is necessary to understand the thigh region. Watch next the muscles of the thigh region.